Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. Today I'm here with Dr. Sara Figueredo. She's the director of this institute, and we're going to talk about stem cells for Parkinson's disease treatment. Hello, doctor. How are you?
Hello, Louise. I'm wonderful. Thank you so much for having me.
We are, as always, wondering how stem cells can work for Parkinson's disease.
Really good question. Parkinson's has been a little bit of a hit or miss type of a condition to treat with anything, whether even it's with pharmaceuticals or stem cells. However, we have found of late that Parkinson's disease responds really, really well to endometrial stem cells. And again, endometrial stem cells are donated from female donors, healthy female donors, and we isolate the stem cells from the uterus of a healthy young female donor. And these stem cells in particular respond really well or diseases such as autoimmune diseases as well as neurodegenerative diseases respond really well to the endometrial stem cells because they have a really high capacity to differentiate into neural cells. So we're very excited and eager to talk about this and get this message out because all kinds of neurodegenerative diseases like Parkinson's, of course, autoimmune diseases like diabetes, multiple sclerosis, and so on and so forth, as well as Alzheimer's, autism, many of these neurodegenerative stroke, neurodegenerative diseases respond really well to with the endometrial stem cells.
How long does this treatment last, doctor?
Okay, so the treatment itself is about 3 months long from the beginning of the pre-treatment protocol, which happens before you come for treatment, and then the post-treatment protocol that continues after you leave the clinic and continue the treatment at home. And so that's a duration of about 3 months. But in a lot of cases, much of the therapies, like the supplements, and sometimes we use, in many cases, we use herbs and certain key minerals and even hormones, that may continue for a while past the 3 months. So the general treatment lasts about 3 months, and depending on the condition being treated, it can go on almost continually and indefinitely, just to ensure that the stem cells are working at their best and the body is functioning at its most adequate. And in terms of when we start to see results with stem cell treatment, and especially with neurodegenerative, we see results more or less within 3 months. It takes a good 3 months to start to see the results. For instance, in one case with we recently treated a spinal cord injury patient, and it was in July that we did the treatment, mid-July, and literally just last week I was doing a check-in with him, and he was telling me that he has been feeling tingling and a tingling feeling in his legs, which he has never felt before.
Wow,
since his accident.
That's great news, right?
Thank you, as well as tingling and sort of almost a sleeping sensation in his legs. So his legs are waking up, literally. He's a paraplegic, so he's paralyzed from the waist down. And it's almost exactly 3 months later that we're just starting to see. And that's because regeneration takes time, so regeneration of damaged tissues take time. And so it was very, very encouraging for the patient. And I kept, reminding him that this takes time. This takes time. We have a lot of damaged tissue. And so this was very encouraging for him. And we're just building on all this success. And this is just the beginning. So yes, it takes a good, at least about 3 months to start to see, if not sooner. We've seen results sooner. But to at least be patient for 3 months to see results with Parkinson's as well.
You mentioned the pre-treatment. What would that pre-treatment will be?
Yes, that would include things like diets, minor dietary changes, especially if there's a lot to clean up. There would be some minor dietary changes like cutting back on alcohol, increasing antioxidants, either in a supplement form or in the diet, for sure. Omega-3 fatty acids and vitamin D, things like green tea and cinnamon, blueberries, so foods that are higher in antioxidants, and so changes like that, as well as stress management. Stress management is really important. We never ever exclude the psychological and emotional aspect of healing. So it's really important that we also address the emotional aspects of having a positive attitude and healing, because so many of our patients have been sick for so long that they almost don't know how to be well. They don't know what to expect, and they don't know how to be if things do start to change, and because they've been in pain for so long, or they've been suffering from some sort of disease or ailment or decline, some sort of declining in the health. And so it's really important that we start all those things pre-treatment. And then when the patient comes to the clinic for treatment, another part of the pre-treatment includes the oxygen therapy as well as hormone therapy, age-appropriate hormone therapy, as well as mineral and certain key herbs that we have the patient start on, depending on the condition, and also the basic minerals that help with the stem cells.
And what will be the standard procedure to apply these stem cells to Parkinson's disease patient?
Yes, that's a very good question. One part of the pre-treatment I forgot to mention is the detox, and that would involve a nutritional IV with organic suppositories and intramuscular shot of B vitamins. So that's part of the pre-treatment also once the patient arrives. So I just wanted to mention that.
Okay.
And going back to your question, Louise, that's a really, really good question, because depending on the condition being treated, there are different modes of deployment or applications for the stem cells. In the case of Parkinson's disease and most neurodegenerative disease, we would apply the stem cells in 3 different ways. It's quite wonderful because we don't want to leave any stones unturned. So if we can get the stem cells to the brain and the central nervous system in more than one way, we will do that, so that we can get the most bang for our buck. So that would include IV, so intravenous application of the stem cells with key components to allow the stem cells to get into the brain, as well as intranasal aspiration of stem cells. So it's like a nose spray of stem cells, and that allows the stem cells to penetrate through the nose directly into the brain. So that's number 2. And then the third way would be intrathecal application of the stem cells, which would involve the stem cells to be applied directly into the cerebrospinal fluid, which is a very safe and effective way of also getting the stem cells to the brain. So with Parkinson's disease, as well as with many other neurodegenerative diseases, these are the modes of application for the stem cells.
Doctor, one more thing will be, how long does this treatment take when they get here to Guatemala? And can we arrange all the accommodations for the patients?
Yes, absolutely. We ensure that the patient is in a very accessible, almost like an Airbnb. It's a very comfortable suite slash apartment that we have the patients stay. And usually the treatment will last anywhere from 7 to 10 days. And we arrange for accommodations so that we have accessibility and we know that the patient is in a comfortable um, environment and that we can have access to them, almost at any time of the day. And so, yes, we arrange for that. And it's a very, very, as well as a driver or a chauffeur that we have for the patients. And we also help with flights and those kinds of things, as well as airport transfers and transportation.
It's kind of a all inclusive treatment, right?
Yes, absolutely. And with Guatemala being such a beautiful, there's so much history here, and it's a destination place where we even help arrange for trips to Antigua and visit the volcanoes and the ruins, and because there's so much to do here. So yes, we help arrange those things as well.
And the treatment will last
7 to 10 days,
7 to 10 days.
depending
Oh, yeah.
on what's being.
You,
Yep.
you said that's true. Okay, doctor, is there anything else you want to add in this podcast?
I think we've covered all of the basics, and we would welcome any questions and contact from our listeners, and they can contact us at info@stemcellhealinginstitute.com. They can also visit us on Instagram and Facebook, as well as our YouTube channel, and call us. We have a U.S. number 209-690-7836, as well as our local Guatemalan number. That's 502-4220-7297. Did I forget anything, Luis?
I don't think you did. Everything is so clear. Well, doctor, we appreciate your time on this podcast, and it's so great to hear that Parkinson disease patients have some hope and hope to feel better, right?
Yes. Thank you so much for having me, Louise. Until the next podcast.
Sure. Thank you, doctor. Have a good day.
Thank you. You too.